Let's talk about health now. A lot is happening in the health sector, and the Aowin Municipality in the Western North region is grappling with several neglected tropical diseases. Now, the area has been declared endemic for yaws, lymphatic filariasis, onchocerciasis, and soil-transmitted helminths. Now, Peter Kwao Adato, my colleague here, he has an exclusive interview with the Municipal Director of Health to get a detailed understanding of the situation in the area and what has been done about it.
The Aowin Municipal District in Ghana is currently facing a significant health challenge. This region is endemic to several neglected tropical diseases, NTDs, including yaws, lymphatic filariasis, onchocerciasis, and soil-transmitted helminths. Local health officials are working tirelessly to combat these diseases through various interventions.
The Aowin Municipal is endemic for NTDs. Yeah, so we have the interventions such as the mass drug administrations we do for onco. But for the yaws, we do case search, and those that come out positive, we put them on treatment.
Joseph Asigri further provided recent statistics to highlight the prevalence of these diseases.
So for this year, January to May, we have recorded 194 confirmed cases of yaws, and there are still more out there in the communities. If we do more tests, we'll get more children who have the condition. And for lymphatic filariasis, we have had 35 for January to May.
Yaws thrives in areas with poor sanitation and hygiene, and common in deprived areas where access to potable water is limited. Onchocerciasis, on the other hand, is transmitted by mosquitoes in riverine areas, whereas soil-transmitted helminths or worms are contracted through contact with contaminated soil.
If you look at the interventions, they are targeted towards those areas where there is poor access to water. We try to get them clean water, provide them with sanitation facilities.
Organizations like RECFAM and ANISVAD are helping by providing water and sanitation facilities and offering livelihood empowerment programs for those affected by lymphatic filariasis.
Well, looking at what we have seen on the field and the work we are doing, it's not possible for Ghana to achieve that. And then the WHO also say that by 2030, they should eradicate NTDs from the whole world. But given the fact that there's this superstitious belief behind it, we don't see how feasible that is going to be.
They are also setting up a community radio station for public sensitization.
Ghana Health Service, they've been doing their part and they've done so well. What needs to be done is, again, more awareness creation, and to let people know that most of the disease, the NTDs, are treatable.
Despite these efforts, challenges still persist, particularly with community perceptions and adherence to health interventions.
So I think RECFAM has really helped us with their project. And they also helped us in the case search. At least when they first came, we did a baseline data collection, we did some case search, and then some community treatment.
Beyond these NTDs, the Aowin Municipality faces other significant health issues.
The number one cause of OPD attendance. These days too, we have diarrheal diseases. Anemia is also prevalent, especially among our pregnant women. There's something that we are trying to understand. Most of the pregnant women are very anemic.
Efforts to combat these diseases are underway, but more support and community cooperation are needed to make a lasting impact. Peter Kwao Adato for GH1 News.